Cloud. Well, welcome to our next installment of the SASGOG Researcher Interview Series. It's my honor to have Dr. Learman here today. I'm Marisa Young. I'm an assistant professor of obstetrics and gynecology at Emory University. And Dr. Learman, thank you so much for joining us. Could you start just please by introducing yourself and tell us where you're from originally, a little bit about your journey and your current position?
Absolutely. Thank you, Marissa. It's a pleasure to be with you today. I grew up in Los Angeles, California, and attended UCLA, where I graduated with a degree in psychobiology. And from there, went to Harvard Medical School. In my second year, I applied for a new MD PhD that they were just launching in the social and behavioral sciences. And then I completed that program with a PhD in social psychology. After that, I returned to UCLA for residency in OBGYN. And after that, took my first faculty position at UC San Francisco, where I was first based at San Francisco General Hospital. So I had 14 years of really great mentoring and opportunities and development there, allowing me to participate actively in all the mission areas of academic medicine, including leadership roles and advancement to full professor. And was really enjoying my work there, not looking around at all, but I was invited to apply for a chair position at Indiana University, where I served for chair as 7 years before accepting a position as a senior associate dean at a new medical school in Florida called Florida Atlantic University. And there I spent 4 years building residency programs. I served as the DIO, interacting with 5 affiliated hospitals and their C-suites, and also worked on faculty development there. And then 6 years ago, I joined Virginia Tech as the second dean of another new medical school, the Virginia Tech Carilion School of Medicine. Along the way, I've served on the boards or in leadership roles for CREOG and APCO and CUCOG and SASGOG. My wife Beverly and I have been together for almost 40 years, and we have two wonderful daughters and two very young grandchildren, one in Ann Arbor, Michigan, and one in Rockville, Maryland.
Wow, that's a really incredible and distinguished career. There's so much that we could discuss that I could ask you, and maybe we'll just get this plug in for another interview with you at some point. But I wanted to particularly ask you about your work in medical education. You've had incredible success producing scholarly products from that work, and that can be a challenging area. I'm hoping you could give us a few examples from your career and some advice for academic generalists with an educational career focus.
Yeah, absolutely. First, I have a disclaimer to make. I really do value the skills that came with my PhD training. It was rich in research methodology, statistical training, conceptual models for understanding how doctors and patients make decisions and interact together, and the influences on those decisions. And so when I was finishing residency, I felt well prepared to team up with colleagues to study important topics at the intersection of clinical and education and social science without completing a fellowship or any additional degrees. But with all of that, I do not believe that a master's degree or PhD is essential for success in educational research and scholarship. As long as you receive the appropriate faculty development and team up with successful mentors and colleagues who may already have those graduate degrees on at least one member of the team. So in our specialty, there are courses for clerkship directors and residency directors that focus primarily on the technical aspects of those roles, which are really complicated. But for OBGYNs interested in educational scholarship and research, I would recommend some different programs. I'd recommend the APCO Academic Scholars and Leaders Program, APCO's Surgical Education Scholars, and now many medical schools have their own teaching scholar programs and even their own med ed research fellowships with mentored research. So if your school has one of those, that's also extremely valuable. The AAMC has a medical education research certificate course, which I've completed too. And Harvard Macy Institute offers 6 professional development courses each year focused on health professions education. So there's a lot there that people can do to get that really great overview that you need to really be knowledgeable about education, research, and scholarship, and before teaming up with those other folks that will make you really successful. But I'd be happy to share a few other career suggestions with examples from my own journey, if that's okay.
That'd be great, yeah.
Yeah. So here are the 3 suggestions, and then I'll go into how they helped me. So first, and it sounds easy, but it's not, find a department and institution that believes in your development and potential. That isn't just trying to plug you in, but actually sees you as someone with an amazing opportunity ahead in your career. Second, within the department you're in, identify the folks who already have a track record of publications that describe your innovation work in education. There are a lot of innovators around, and it's real exciting. But in terms of getting it into scholarly activity and publication, that's where you're looking for folks that have already been able to do that, and they can become your mentors. If you're the first person there who wants to do that, that might be a challenge for you. And then third, identify colleagues in the dean's office or the teaching academy, if you have one, whose job it is to support educational research and scholarship. They do exist, and I didn't know about them for quite a little while, which I'll tell you about in just a second. So how did these things help me along the way? When I interviewed for a faculty position at UCSF, I was a chief resident planning a career as an academic generalist, looking for the right institution, but close enough to Los Angeles for our children to see their grandparents and extended families. There's like a 1 hour by flight kind of circumference there. And so in the final stages, I interviewed with the department chair at UCSF, who was a nationally renowned reproductive endocrinologist and a basic scientist. And he asked me what I envisioned for myself in 5 years. And I answered honestly, I said, I'd like to be the residency program director. Now, at that time, the departmental leadership was predominantly subspecialists, including all the previous residency directors. And here I was, this completely green chief resident, not having passed my boards yet because I am just a chief resident, without any plans for fellowship training. And to his credit, the chair did not grimace, he did not chuckle, he did not condescend with a smile. Instead, he agreed to allow me to serve as the San Francisco General OBGYN site director for student and resident education. So this sent me the message that this department, which was very subspecialty oriented, was open to the idea of developing academic generalists as educational leaders as well as researchers. And that was really very important in my decision to go there. So then within a few years of joining, I was invited to be part of writing teams to describe our innovations in problem-based learning, which we had developed for our women's health preclinical curriculum for medical students, which was new at the time, and separately to describe our unique approach to teaching medical students on our clerkship the critical appraisal skills with projects at San Francisco General. The lead authors of those papers were both senior faculty with track records of publication in both education and clinical research. And those two publications appeared in the Gray Journal and the Green Journal with me as author number, 3 or 5 or whatever it was. But I was really grateful to be part of that. And it's, again, a signal was that these experienced educators and clinicians were willing to take a new person and bring them aboard and help me become part of the innovations as well as the scholarly activity associated. And that's only because they already knew how to do it. They were already there doing the work, and they could mentor me in those ways. Then later, in the mid-career part of my time at UCSF, I was really focusing a lot on federally funded clinical research that I was doing. I was serving as the residency program director, and I was also a member of our Academy of Medical Educators, where my role was to act as their liaison to the dean's office. And this is where I developed a really strong and collegial mentoring relationship with two experts that are well known in the Medical Education Research Committee that were in that dean's office. One's a PhD named David Irby, and the other's an EDD named Pat O'Sullivan. So working with them opened my eyes to the value of the dean's office in supporting departmentally based faculty leaders. I worked with Pat and several colleagues to study how to promote reflective practice in OBGYN residents and how to assess their progress using a rubric that we developed, and that was published in the AAMC MedEd portal and has been cited quite a bit. We also had a Gray Journal publication and doing a little bit of research with that. And that was all because of those connections with the dean's office. That was the only way I got plugged into that kind of work. So bottom line, I was really fortunate. I had guessed my best in terms of where I was going for my first institution, and I had found a department whose leadership believed in developing their most junior faculty fulfill their potential in medical education and research. Faculty colleagues who were already publishing innovations in medical education invited me to join them, and the dean's office that had several experts in this area. That experience helped me to make a decision to become the department chair at Indiana University, which already had innovators in medical education among the faculty and strong leadership in the dean's office for med ed research and scholarship. So that really set me on the right trajectory in terms of how to build a department, hopefully an institution that supports medical educators.
Wow, those are incredible insights and experiences. Thank you for sharing that. Um, could you next share any kind of practical tips or tricks for helping bring the work we do, which is less likely to be considered traditional research or traditional scholarship, into the scholarly arena?
Yeah, sure, absolutely. The first is the basics of excellent scholarship and research, which is to build whatever the project is on established knowledge, and to follow a systematic process, and then to report it in a peer-reviewed fashion. And the goal here is dissemination. The gold standard for dissemination is peer-reviewed publication. So that's really where it all ends up. But space is limited in publishing educational innovations in our specialty journals. So for faculty who have done great work doing a needs assessment, curriculum development, curriculum evaluation, developing a new tool, I'd recommend submitting to the MedEd portal where you're going to have more space to fully cover the great work you've accomplished with more of that work you're able to show it more on the MedEd portal. And now it's indexed in PubMed, so it'll contribute to your peer review publication lists and your impact factors and things. For those who've completed a study that fits into a typical journal article, there's just a long list of journals featuring medical, surgical, and health professions, innovations, and research. We don't have one in our specialty per se that is focused on this. Some of the studies we might publish in the Journal of Surgical Education or other publications that are outside the specialty, that Journal of GME and others, et cetera. So how do you figure out what your study is going to fit into, what the likelihood of success is? Well, find a mentor in your department, your institution at APCO, CREOG, or SASGOG to help you match your work to the best dissemination prospects and have like a lineup of submit here, then submit there. And that's the way to get it published. There are enough education journals out there that persistence can pay off for sure. And for those getting started, there are also poster and oral presentation opportunities at our OBGYN education meetings, as well as regional meetings of ACOG and AAMC. So don't forget, even the non-education meetings will often feature some of educational projects particularly relevant to clinical OBGYN. So I think those are some good general advice. I guess more specific advice comes from that mentoring relationship that I would also recommend.
Absolutely, and some common things. It sounds like there's a need for an education-focused, medical education-focused OBGYN journal. So SASGOG members, let's make that happen maybe in over the next few years. All right. And so just given kind of big overview, given your esteemed career and experience, I'd like to invite you to share any thoughts you have on how academic specialists in obstetrics and gynecology engage in biomedical research generally. What do you think the current state is, and where do you see the field heading?
Yeah, there are a lot of thoughtful people who've been really pondering this for quite a while. So thanks for asking for my 2 cents here and for posing the question. I do believe that academic specialists have much to offer across the full translational science continuum, but for those of us who plan to stay clinically active, I would suggest focusing on the right side of that spectrum, less on basic and preclinical studies, more on screening, prevention, comparative effectiveness, dissemination, and implementation. Those areas align best with the clinical expert niches that many of our academic specialists have in their departments, as well as their roles in quality, safety, and process improvement. So you can put that together, that identity together with the scholarship and research that go along with that. And it's important. Successful implementation of evidence-based practice is essential for bringing the value of discoveries to our patients and communities and moving the needle on population health outcomes. So even in this current environment with headwinds limiting federal research funding and narrowing the operating margins of many hospitals, I expect there will still be funding for research that can be closely linked to improve health outcomes. At least that's my optimistic perspective.
I think we have to be optimistic. Thank you so much, Dr. Learman, for your insights and all of your wisdom. Is there anything else you'd like to share with our viewers, or anything else you'd like to say?
Well, I would just say, as a very early champion of SASCOG with our other founders, it warms my heart to see how the organization continues to thrive and add value for our members and our specialty, including the role of this series, which hope is instructive and helpful for our listeners. And I just want to thank you again, Marisa, for inviting me to join you.
Thank you. Okay.